Professor Marcus Skinner says closing the Mersey unit was the clinically responsible thing to do.
To retain two smaller intensive cares in the region are not viable. If we coalesce both units to make a viable unit and in line with the national evidence-based data to show that with a population of over 100,000 people, a single unit can be sustained with the right staffing, both medical and nursing.
The problem is that the Tasmanian government wants to destroy the Mersey Hospital as it has been known, and the Howard government will not let it, Mr. Speaker.
Unfortunately, we've been in a position where a political hand grenade has been thrown by the Prime Minister and by the Minister for Health, Mr. Abbott.
It was a little bit unreasonable of the Tasmanian government to, as it were, have a hissy fit and say, OK, have it now. They've got to allow us to do our due diligence, to talk to the relevant people, to gather the necessary information
and get our service back that we have enjoyed in this community and have earned in this community.
Professor Jeff Richardson from Monash University was the author of one of two independent reports that inspired the state's shake-up of its health services.
And unfortunately, that hospital is going to be driven by these sadly parochial opinions that seem to dominate in Davenport, which are frankly dangerous for the population.
Since as far back as 1990, when Howard Government Minister Brendan Nelson was then the state president of the AMA, doctors have been lobbying for a rationalisation of health services for the 105,000 people on the northwest coast. As well as the decentralised population in this region, healthcare providers also have the challenge of its demographics. More than 39% of those who live in the Braddon electorate are elderly, many moving here for a quiet retirement.
You very quickly find out when you've been here for a few years that you haven't got the services that you're going to need as you've made your sea change and expected life to be wonderful.
The state's clinical services plan has bipartisan backing and full AMA support, and clearly states having two ICUs in the region is neither safe nor feasible.
One of the most important things to me and to my colleagues across the region is sustainability. The reality, to produce sustainability, you must provide critical mass of specialist staff, both medical and nursing.
Back in 2004, a private operator struggled to provide full services, forcing the state to take control. Now it's over to the Commonwealth, which has tapped into an emotionally charged issue in an extremely marginal seat.
I am assuming that the state government was able safely and effectively to deliver intensive care unit services in the past, and so I think that the Commonwealth should be able to do it in the future.
We've seen enough crises and enough rescue packages to know that